So Brothers in Public Health, for those who do not know, essentially the mission is to increase the involvement of men of color in public health to advance the field, the culture, and the perception of public health amongst communities of color. And this is the launch event for the Greater Providence chapter, the Public Health in the Current Climate event. It's a discussion with four esteemed panels, and we are very much looking forward to hearing about the expertise, the work, the accomplishments of our panelists, and we'll move forward into introducing them so we can get to our discussion and hear what they have to say. So first, in no particular order, we have Dr. Larry Warner. He is the founder and managing principal of ILS. He earned his Doctor of Public Health in Health Equity and Social Justice from the Johns Hopkins Bloomberg School of Public Health and a Master of Public Health from the Brown University School of Public Health. He partners with mission-driven organizations across philanthropy, public health, and public safety to elevate impact, leadership, and strategy. Dr. Warner serves as the president of the Rhode Island Public Health Association and adjunct faculty at Brown University School of Public Health. His work combines strategic planning and leadership development to help organizations turn purpose into measurable results and navigate complex change with clarity and momentum. Next, we have Angela Ankelma. She serves as the founder and principal of the Bannerman Group, a strategy and equity focused consulting practice advancing inclusive leadership and measurable community impact. She earned her Master of Public Health from the Columbia University Mailman School of Public Health and her Master of Social Work from the Columbia University School of Social Work, and is now completing an executive doctoral program in health leadership at the University of North Carolina Gilling School of Global Public Health. Her recent leadership roles include Vice President and Executive Director of the Equity Leadership Initiative at the Rhode Island Foundation, where she led a statewide nonprofit pipeline for Black and Brown leaders and oversaw $8.5 million in investments. Executive Vice President and Director of Community Investment at the United Way of Rhode Island, and co-director of the Health Equity Institute at the Rhode Island Department of Health. She was also awarded the Robert Wood Johnson Foundation Award for Health Equity. Angela's work integrates equity-driven philosophy into promoting sustainable impact across public health and philanthropy. Next, we have Joshua Xavier Esquire. He has recently started his own law firm. Clap it up for this man. Put some claps and emojis in the chat. That is phenomenal. And this is following over a decade's worth of experience serving in counsel and associate attorney roles across 3 Rhode Island-based law firms. He earned his Juris Doctor from the Roger Williams University School of Law and a Bachelor of Science in Media, Culture, and Communications from New York University. Joshua is a civil rights and employment attorney licensed in both Rhode Island and Massachusetts, whose work advocates for equity and accountability through the law. His practice, spanning employment discrimination, wage and hour enforcement, housing rights, and police misconduct litigation, reflects both practical and philosophical applications to public health by addressing the structural conditions that underline economic stability and community trust. Through litigation and board leadership with the Rhode Island Center for Justice, he works to strengthen legal protections that promote fair treatment of people and support the foundational conditions for healthier communities. Next, we have Alexander Bonanno. He serves as chapter lead for the Greater Boston chapter of Brothers in Public Health. He earned his Master of Public Health in Health Services Management and Policy from Tufts University School of Medicine, and a Bachelor of Arts in Latin American and Latinx Studies with a minor in Global Health Studies from the College of the Holy Cross. Alex is currently a Health Equity and All Policies Manager with the Boston Public Health Commission, Office of Racial Equity and Community Engagement, where he is dedicated to advancing racial equity and shaping policies that drive systemic change in public health. His work combines policy leadership and community engagement to address structural barriers to the health of Boston, Massachusetts residents. So we're very excited to hear from our panelists today, and we will start with our set of questions that we have to hear more from their experiences. So first, and feel free to answer in no particular order, what inspired you to pursue your respective career trajectories, and how has your identity as a person of color uniquely defined that journey?
I'm happy to kick it off. So I sort of stumbled into public health, admittedly. I had um, started my undergrad studies on a pre-med track and fortunately had the flexibility of the open curriculum at Brenham to take a lot of coursework outside of the either your major or pre-med related courses. And so I took a course on Intro to Anthropology, which was an interesting way of thinking about systems from a deconstructed perspective, and then an Intro to Medical Anthropology course. And it was during the Intro to Medical Anthropology course I had an opportunity to interview a classmate of mine, and one of the responses that they gave me to a question was that people are so busy taking care of themselves that they don't have time to take care of themselves. And it was a simple but profound statement to an undergrad Larry that really forced me to think differently about community and about household levels contributors to health. Um, and so I took that. I would say that was my starting point in my public health trajectory and thinking beyond the clinical setting, what are the contributors to individual and community health that are that have factors that can be mitigated, that we can help promote healthier outcomes through, and through a combination of professional and academic experiences, have really become more steeped in the language, the skills, the frameworks, the relationships, that help to understand what are the root causes of health disparities and what are the enabling conditions for health equity. And so I would say that, through a variety of experiences, some of which you named in my intro, I've had an opportunity to contribute to public health from a systems perspective. I've served in public health specific organizations. I've served in advocacy organizations, and then have also had an opportunity to support public health and social determinants of health through philanthropy as well, both alongside Angie for a period of time at United Way, and then in parallel with her in Rhode Island in different spaces. So that's been sort of um, my my trajectory, uh, my identity as a person of color. Um, I think it helped me to have to see some of I think to have greater proximity to community and to people with shared experiences and identity, but also recognizing that there's so much variation between the Black community. Like people and the data lumps us all together, but as a person of color, it's been helpful to understand that my Black experience is not the same as someone else's Black experience who is either first gen, second gen, third gen, or from an African country versus from the Caribbean versus multiple generations of African Americans. So it's helped me to understand there's a lot of nuance, and that often gets mashed together when we simplify and collapse data into simple categories.
I'll jump in next. And I apologize to the panelists. I've talked to, the attendees. I had another event and a little bit delayed in getting to my destination, but thank you for having me here today. I'm incredibly excited about the Brothers in Public Health. So congratulations on your inaugural event. Uh, I would say like my brother Larry, I began on a similar trajectory. I started as a daughter of African immigrants. I started out as pre-med because that's what you do. You're the pre-med, your law. Joshua followed through on the law, but some of us didn't get there first. So I started pre-med. I got through my first semester, and I think it was a calculus two or it was a class. And after that first test, I'm like, we're gonna make a left here for myself. And then I walked into a psychology class, and I absolutely loved it. And so in the undergrad, I ended up loving two of the majors were the classes that I absolutely loved, which one was the psychology major, and then number two was Africana Studies, which was one because of the fact that I was completely fascinated with all the history that I was learning about the people of my culture and my community from the diaspora that I had never learned at school, beyond the typical 30 days or the 28 days we get in Black History Month. And so I was just fascinated and wanted to learn everything about it. And so after graduating undergrad, I worked for a number of years in child welfare services, both in Rhode Island and Massachusetts. And after about 3 or 4 years, decided that I wanted to go to school to get my master's in social work. And so I started my journey at school of social work. And one of the things that I learned when I was, actually, I'll pause for a second and say, I moved to New York City to start my graduate degree in social work 17 days before September 11th, which was a critical point at that time. And so right around that time, there was a number of public health issues. Some of you may not be aware or remember that right around that time, after the September 11th incident, there was a lot of public health threats in our country, biological warfare. So the anthrax was a threat to our country. And so that fascinated me. And at Columbia University, they had the wonderful opportunity to do 2 master's degrees in 3 years, pretty intense. And so I chose to do the master's in public health and social work. And one of the things that drove me to more public health systems is that in my social work program, I was seeing my licenses in, well, I did clinical social work track and licensed in Rhode Island as a clinical social worker. And what I realized that the children and families that I was working with one-to-one, a lot of the issues and the problems and the stresses on that family were systems-based work. And so, seeing families and individual and family therapy, and it was an issue with the school system, or it was an issue with the housing system, or because the family wasn't making enough money, there was a lot of stresses on the family, and they were impacting their mental and physical health. And so I leaned into that when I started my public health program. But more importantly, there were 2 phenomenal faculty members at Columbia University School of Social Work who were really, really leading the pack when it comes to social and environmental determinants of health. And they were Dr. Robert and Mindy Fullilove. And so I took their first social environmental public health course, and I was hooked on the social medical sciences, the social determinants of health from all factors. And so that's what really got me to the policies and systems work and focus as well too. And so I spent a number of my years working. I worked for about a decade. I did a little stint at CDC in Atlanta as a graduate student over the summer, doing a lot of work on improving physical activity among Blacks. Worked with researchers nationally on writing a manual for the CDC, which was distributed to states. And then when I graduated, sorry about that. And then I ended up working at the Rhode Island Department of Health in the Childhood Obesity Prevention Program, doing a lot of work on improving childcare obesity prevention policies statewide. Then moved into a lot of work in for the State Office of Minority Health, and then really started doing more place-based work. The state of Rhode Island was doing what we call the health equity zones. And so I was the inaugural director of the health equity zones for the state of Rhode Island, and really looking at how places make people sick. And so, that work inspired my work in public health. But I think what I love most about my career journey is that I've been able to sit at tables where public health professionals traditionally don't sit at. And so, I love sitting at economic development tables or education tables, because I feel as though public health practitioners, in the way we think, in the systems-based approach, and the way that we're trained, whether it be gathering data, looking at policies, engaging members of the community, I think our training well equips us to sit at any table. And so you'll find public health practitioners in almost every setting. And I think our skill sets make us strong team members and also professionals in multiple settings.
I can go next. Thank you to Anthony and Darwin for the invitation. I really do appreciate it. It really is an honor to be invited as the panelist who is not in public health. I really do feel proud to be invited to this conversation, that you guys would open up the panel to someone who does not work in public health. And I totally agree with the reasoning behind inviting an attorney to this panel, because I do agree with Brothers in Public Health and with Anthony and Darwin that there is definitely a direct connection between legal justice and public health. There is a direct connection that cannot be erased. Having justice and equity in the legal sense directly correlates to your positive impact on your health and on public health as a whole. When there is injustice, there is also a detriment to the public health. So I'm really grateful that we can talk about this overlap between the legal system and public health. How did I get into my line of work? It really goes back to my college days. I went to college in New York City at NYU, and I started there in 2006. And in 2006, that was a time in which, not too previous to the time that I arrived, there was a significant and severe and unfortunate act of police brutality that was taken on and against an individual by the name of Sean Bell. It's an individual who was killed by the police on the night before he was supposed to get married, and he left behind children and obviously his fiance. It was a very sad, sad time. I attended a few protests protesting his death and protests calling for accountability against the police department and the individuals who caused his death. And similar to what Angela mentioned, there was something inside of me that enjoyed the advocacy. There's something inside of me that enjoyed the protesting. There's something inside of me that loved getting out there, making my voice heard, and advocating for justice. I can't explain it, but I think we all know what that feels like, right? It's what drives us to decide to study what we decide to study. It's what drives us to decide what jobs to take. It's what drives us to pursue the careers that we have. There's just something inside of us that says, you know what, this feels right. I enjoy it. I'm good at it. I want to make this my life. And so in the beginning, I didn't really know what to make of it, because there's so many ways you can advocate for justice. You don't necessarily need to go to law school to be an advocate for justice. And I would venture to say that individuals who are in public health also advocate for justice. Justice is not strictly tied to going to law school. But for me, I wanted to take that step and to actually advocate, legally speaking, for that type of justice. So I began to take civil rights coursework. I began to take constitutional law coursework in college. And I actually took the additional step. I reached out to the fiance of Sean Bell and invited her to come speak at NYU to talk about the incident and to talk about her life as someone who lost her fiance as a result of police brutality. And in addition to having her come and speak, I also invited a representative from the New York ACLU to come speak to talk about the legal side of police brutality and the legal aspects of the case. In conversations like that, you take the conversations like that with his fiance and the representative from the New York ACLU. I took that and I combined it with the coursework I was taking in civil rights and constitutional law. I decided to go to law school and to specialize in civil rights work. When I got to law school, I quickly realized that that phrase, civil rights, is very, very, very wide and very encompassing. It's like someone saying, "Oh, I want to be a doctor." Okay, but like you can specialize or different aspects of medicine. You can there's so many different ways. You can do so much with a degree from medical school, and it's the same with law school. And so during law school, that's when I really, really, really kind of specialized and focused in on police brutality, Fourth Amendment violations. And Fourth Amendment is the amendment that essentially prohibits excessive force against individuals. It also prohibits seizing and arresting individuals without probable cause. I also took classes in the First Amendment, and I also took classes on the 14th Amendment Equal Protection Clause. And the Equal Protection Clause essentially says the government cannot treat people inequitably or unequally without due cause or without meeting the proper standard. I enjoyed those courses. I thrived in them, and I knew I wanted to pursue that area of the law. And so since then, I have taken on civil rights cases against the police. I've also taken on fair housing cases against landlords, including fair housing cases in which my clients were discriminated against by their landlord on the basis of their race. And I've also jumped into employment law and employment discrimination. So in employment discrimination world, it is against the law to treat employees or to take adverse action against employees on the basis of their race. It's not just race. It's also against the law to take any adverse action against employees based upon other protected classes. But specifically, I know we're specifically talking about race, ethnicity, national origin, and things of that nature. And so to answer the second part of the question, how has my identity formed my decision? Well, for me, it's a very personal question, and it goes hand in hand with what I do and the reason why I do what I do. Sean Bell is an individual who looks a lot like me. He's an African American individual who was killed by the police, like so many and countless men in our country who have been killed by the police. So many of them have been Black or African American. And in my world of employment law, civil rights law, fair housing law, I take on cases in which individuals have been treated adversely based upon their race. And I cannot tell you how many times clients have straight up said to me, wow, I am so glad and I feel so comfortable with having an attorney of color. And maybe you in your world of public health, maybe you've heard the same thing because it goes hand in hand. I know I felt that way. And there was a time in my life when my PCP was a man of color. I felt more comfortable. I felt like it was more relatable. And it's the same in the law because to a certain extent, even though I might not have gone through the exact case, I might not have lost my job because of my race. I might not have lost my housing because of my race. I might not have been fired because of my race. However, I do know what it's like to be a Black man in America. And that helps me relate with my clients, and it causes my clients to be more comfortable with me.
Awesome. I can go next. Can you all hear me okay? Thank you all so much for the other panelists that are already sharing their stories. Thank you, Darwin and Anthony, again for the invitation. Um, so what inspired me to pursue my career? It's very personal for me. I'm from Boston, as you all know, from Roxbury in particular, which is one of Boston's primarily Black neighborhoods. Grew up with an African American mom and then a Puerto Rican Honduran dad. So also echoing the fact, and I'm also a twin brother, so I echo what everyone else shared around. It's either you were going to be a doctor, a lawyer, or something. So that was always told. And then with me being a twin, I was dedicated to being the doctor, and then everyone else was told my brother that he's going to be the lawyer. But what actually really inspired, without me really having the words to describe my experience, after my mother had gave birth to my youngest sibling, she ended up having a tubal ligation. She was done having kids. She said she didn't want any more, and she eventually, unfortunately, had an infection. And a visiting nurse was supposed to come to help clean and pack the wound. And she came once, called me into the room, white woman, called me into the room, showed me how to do it, and said, now you're going to be doing it because I'm not coming back here. Roxbury's too dangerous. It's too Black. I don't feel safe. And literally at the age of 8 years old, I had to pack and clean my mother's wound. So when I think about my career trajectory and working in public health, um, it's very personal to me, especially with that question around how does my identity as a person of color show up in the space. I didn't have a choice to not have that be the case. Um, and just in thinking of, so I also echoing everyone else, because when I went to college, I was like, all right, I'm going to be the doctor. I'm going to go. So I started pre-med, was a chemistry major pre-med for a couple of years, and then ended up having the opportunity to shadow a physician in India. And all of his patients there were organophosphate poison victims. So they were inhaling the pesticides that they were using for their crops because they didn't have, one, the money for the PPE, or two, the understanding and knowledge that they needed PPE when they were spraying their pesticides. And so I came back to my college professor and told him about my experience. And he saw how passionate I was around the fact that they didn't have the education, that they didn't have the income. He's like, well, that's not medicine, that's public health. And then that shifted my trajectory. From there, I decided to create my own major, my own minor in global health studies because they didn't have set coursework. And then created my major in Latin American studies as well. Had the opportunity to study abroad in Costa Rica, studying neglected tropical diseases. And then after undergrad, moved to Brooklyn for a couple of years and worked as a health educator for a high school in Brooklyn. Started that school's entire health curriculum. Um, and from there, stayed in the education space and the youth development space for a little bit. Almost went to Fordham for my MSW, but then decided to move back to Boston during the pandemic. And it was during that time where everyone was, saying that it was a double pandemic. They were coining the term double pandemic because, of the fact that people were dying from COVID. But then in addition to that, the pandemic of racism, the fact that Black and Brown communities were dying dying disproportionately to the virus, but then they also weren't receiving the same level of access to the vaccine. So from that experience, I partnered with the Black Boston COVID-19 Coalition to help address that vaccine equity here in the Boston, or the vaccine inequity here in Boston, to make sure that the people who needed it, or who were dying disproportionately from the virus, were actually able to receive, that vaccine. And then from there, that really triggered my turning point of like, okay, I felt like I was doing public health adjacent work, especially when you're thinking about the social determinants of health, when you're thinking about, education. Um, I was like, okay, and even youth development, I was thinking, all right, it's time to actually go back to school and pursue public health proper, for lack of better words. So that's what prompted me to study and receive my MPH from Tufts School of Medicine. And it was because of like those individual level approaches of my prior experiences, like working in the schools, being in Costa Rica, being in India, and being able to provide some recommendations for how those communities could, live healthier lives. That's what prompted me to make sure that I wanted to pursue a concentration more on management and policy because I had that individual and interpersonal level experience. I wanted to see and learn more about how I could be making a better impact at the policy level. And then from there, now I work at the Boston Public Health Commission in the Office of Racial Equity and Community Engagement. And in 2020, the city of Boston declared racism a public health crisis and gave the Boston Public Health Commission some funding. And so I currently have used that funding after engaging the community and asking them what do they want us to see? What do Bostonians want to see us use this funding for? One of the things that they said was education. And so now I currently use that to oversee our Generational Health Scholarship Program, which provides monetary support for students, for BIPOC students studying for their first degree in either STEM, behavioral health, or the health sciences. And so it was just like funny just seeing how full circle that moment went for me. Like now I'm actually leading an initiative that has to do with addressing systemic racism's impact on education because again, social determinants of health, we understand that if you have lower educational attainment, that may lead to adverse health outcomes for you later on. So being able to actually address that and use my prior experience as an educator to help inform the work that I'm currently doing now for one of this major projects that I've been able to oversee and manage in my role, I think is definitely a full circle and rewarding experience for me.
Thank you so much. Thank you for all those responses, your career trajectories, those moments in your background where you really just discovered, what you wanted to do and felt that passion. I really appreciate it and definitely heard and resonated with some of those moments you mentioned. Bringing it to the theme, of our event today, with the current climate. How would you characterize the current state of public health in the United States, particularly under a federal administration that consistently undermines science, diminishes public trust, and often seems to dance around the law?
I would say first, for all the reasons you've included in the question, I would say public health is under a state of attack. And fighting back from a position of having been underinvested and undervalued for decades, with the brief exception of people realizing how important public health is during the pandemic. That said, there's so many chips in the glass that we're trying to mitigate right now between uh, diminishing public trust, misinformation, disinformation, walking back on decades of established science and best practices with respect to vaccines and other preventative measures. The challenges around the legal environment and to my brother, attorney Joshua, I would say you are certainly part of the public health family because nothing gets done at a systems level without good policy, and good policy requires good legal experts. So you can definitely put the public health patch on your shirt or jacket. Um, so we're fighting a legal battle, fighting a scientific battle, we're fighting a trust battle, we're fighting a fiscal battle, and at the same time, we're seeing that this administration will do what's convenient for its own priorities. And health equity is under attack, but is still being prioritized just from a different starting point. So this recent hundreds of billions of dollars in rural health transformation monies, as one example, it's really intended to address health equity, but starting in rural America, as opposed to addressing urban geographic disparities and disparities that we've been trying to mitigate that have been affecting communities of color for generations. And so there's still health equity work happening just with a different starting point. And so the challenge for us collectively is to figure out, well, one, to continue to fight the good fight and to mitigate where we can and to lock arms across the public health diaspora to figure out how do we continue to put up a good defense against the attack against public health. And then secondly, how can we use the administration's game in our favor? And if the priority is we're gonna say rural health is the priority of the administration, okay, are there priorities that we can adopt that are consistent, aligned with a rural health transformation initiative that then benefit other communities as well? That's one thing for us to consider as a sector or as a field. But it is very dizzying, and as many people have realized, a lot of what we're experiencing is overstimulation from so many different fronts that is causing sensory overload at the individual and the community level. And so we really have to figure out how do we best focus on the most pressing issues for today and then collaborate across industries, across communities, across areas of expertise to hold the line on science, on funding, on policy, and to reestablish public trust. So it is a challenging time. And the last thing I'll say is while there's a lot happening at the federal level, much of where the rubber meets the road is at the local level. So at the community, I definitely commend Alexander, the work that you do in the Boston Public Health Commission, and so many community level initiatives and offices of public health across the US. That's where we have the best opportunity to mitigate bad policy or to ensure that we're implementing good policy that then can promote positive public health outcomes and serve in the interest of public of health equity.
I feel like Dr. Warner wrapped that up really nicely. But I feel like the only thing that I just wanted to share was just echoing that last piece, especially around like the local level. And thank you for the shout out. I appreciate it. Um, I feel like it's been interesting for me, especially after convening with other local city health departments who might be in states where they have to, really deal with preemption in a way that I'm blessed and lucky enough to not have to deal with that in Massachusetts. So to be able to even use the words health equity, we just launched our most recent Black life expectancy report, and I'm sure that that would have been redacted or not even possible in some of other local health departments. So I think definitely echoing what was shared around just all of the why am I blinking on my English today? Just all of like the bombardment of just like all of the news and everything and how that can definitely lead to folks feeling stuck or maybe in stasis and like not knowing what to do or how to move. But I definitely think that last piece, it's been a blessing for me to see, at least at the local level, that we are seeing, movement there, that folks are still hopeful and not just being stuck. Like there is movement that's happening, that there's real coalition building that's still ma being maintained. And so I feel like that gives me hope for sure.
Thank you. From my vantage point, I have witnessed damage to public health when unjust legal actions are taken. First and foremost, we live in a country where I would say the majority of us who are fortunate to have health care, most of us get our health care through our employer. That is the way that the system works, whether we like it or not. That's the United States of America's healthcare system. Most Americans get their healthcare and their family's healthcare through employment. So when an employer acts unjustly and fires and terminates an employee against the law, whether it be because of their protected class, like their race, or because of their protected conduct, which are things like complaints over violations of the law, things like complaining about discrimination, or things of that nature, what have you. When an employee loses their job, more often than not, they're also losing their health care. Not only are they losing their health care, they might also be losing their family's health care as well. And so there is a direct connection between an employer taking unlawful actions and the employee's health. And that, to me, is a serious issue within our public health system. And obviously a reason why employers need to abide by the law, because when an employer terminates someone, you're not just cutting off their income, you're also cutting off their access to healthcare, which is a travesty. And I also have two real life examples as to how legal actions have affected individuals' public health. One is on a micro scale and one is on a macro scale. The micro scale is a case that I actually personally handled. I represented an individual who was falsely accused of breaking and entering into an apartment. And so when the police were called to investigate the breaking and entering, the victims of the breaking and entering identified the alleged attacker. And they stated to the police officer that an individual, let's call that individual Hank, right? Let's just come up with the word. Let's say that individual that they said, they identified the individual as Hank. That police officer when that police officer ended that conversation, that investigation into the discussion around who committed the break and entering, that police officer said, well, I'm going to do a lineup and I'm going to ask you to pick out Hank from that lineup. So what that police officer actually did was the police officer went to the courthouse and submitted an arrest request or a request for a warrant for an arrest. In that application, that police officer misstated the facts. They fabricated. They did not say that the victims identified Hank. They said in writing that the victims identified my client, someone who was not Hank, someone who was not there, and someone who did not commit the breaking and entering. Not only did the police officer make that mistake, the police officer also never carried out that lineup that he promised the victims that he would carry out. So my client was arrested for that breaking and entering, a crime he did not commit. And not only was he arrested once for it, he was arrested twice for it and had to spend 31 days in prison for that crime, despite the fact that he was innocent. And here's the public health aspect. Not only is it unhealthy to be incarcerated and to live in prison, but while he was incarcerated, he contracted COVID-19, detrimentally affecting his health, all because a police officer lied to the judge, causing my client to get arrested. So that's a real life example of someone's unlawful actions directly and detrimentally affecting someone's public health. If that officer never lied in that police statement, if that officer never lied in that document submitted to the court under oath, my client never would have been in prison. And if my client was never in prison, my client never would have caught COVID. Right? So there's a direct connection between the police officer's unlawful actions and my client contracting COVID-19. And the second example is more of a macro example. We can all remember in October of 2025, the government shut down. And what this administration did was they argued that because of the shutdown, they could not fund SNAP benefits. They could not fund food stamps. And so effective November 1st, the SNAP program ended and approximately 42 million people lost their SNAP benefits. These are people who need help, right? These are indigent populations who are depending upon the government to eat, literally eat. They get their food stamps to eat. That's the sole purpose of the food stamps. But the government misrepresented and claimed that they couldn't fund SNAP because of the government shutdown. That, quite frankly, was just not true. The SNAP program has a reserve. It's called contingency funds. And those contingency funds have been used in the past for the explicit purpose of funding SNAP. And in fact, the Trump administration used those contingency funds during the first Trump administration. So they knew very well they could have dipped into those funds, and they chose not to. And it wasn't until a federal judge in Rhode Island, who ordered the Trump administration to take those contingency funds to fund SNAP and to restore those SNAP benefits for those 42 million people who were deprived of their food stamps, right? Again, a direct correlation between an unlawful action of stopping SNAP and taking that and connecting it to individuals who were detrimentally hurt with respect to their health and their healthcare, literally people who could not eat because of a legal policy and a legal decision that was made.
Sorry, have the other panelists gone? And can you hear me?
Yes.
Can you hear me?
Yep, we hear you.
We're still on the question of the ways in which public health is being fought right now?
Yes, current state of public health in the United States.
Current state of public health. I think Larry was a bit more optimistic than I was. He was a glass half full, and I'm normally a glass half full. I can't count the amount of times that I've kind of yelled and screamed and shouted at headlines and updates in the news. We've made so much progress in public health. Um, and it's really disparaging to see the progress that we've made. Just, we had trouble with people trusting science, particularly amongst historically marginalized communities, as a result of, health in general. And now we're slipping further back. It's hard to, have people even trust what we're saying. Public health, has walked the fine line in making sure that we're communicating in a way that the public can understand. But now, you have the government, which some people do or do not trust, communicating erroneous information, walking back on, declarations and generations worth of science. So it's disparaging. I think one of the ways that I think is going to be most helpful is really locking arms with people who are communicating. And I think I, learned a lot about how those public health practitioners or municipalities or states that communicated effectively to the population in a way that the population can understand. And so I think, making sure that we're communicating the science, um, despite the fact that what our government's saying. I see a number of regions and states forming local science collaboratives as a result of the work that's happening in Washington. And then, despite the fact that the government has purged an exorbitant amount of experts, I think we have these experts now who we can potentially tap in some of our local and regional public health faculty, local public health departments, local public health schools, and public health organizations. And so, my hope is that we tap into the brain drain that we've experienced on the local and national, the national level, and also really encourage people that there's still work to be done in the work. And so, I think that getting the public health degree is still incredibly valuable and important. As I said initially, that I think that we're some of the best trained professionals in multiple settings. And so I think that we should encourage the next generation of public health practitioners to go into the various spaces, whether it be communications, whether it be state public health departments, whether it be in educational spaces. And so, that's where I'm most hopeful, is one, encouraging people to continue. Now that there are more people of color, first and second generation people of historically marginalized communities in public health, let's encourage others to understand it. I think one of the themes that I heard amongst all of us is that we all kind of stumbled into public health. And so let's help the next generation actually be intentional about, hey, I know that there's a degree in public health. I see some schools locally have public health pathways. The college I went to didn't have it now, but they also have a public health pathways. And so that's encouraging that we're going to have professionals in the field who really like, this is what I want to do. This is a career and I can make a career out of this. And there's something I can contribute to this as well.
Absolutely. Thank you so much for that. Definitely, it's funny. I was actually at a volunteering event earlier this morning, and I was talking to a high school student that was like, "Oh, I kind of want to do something in medicine, but I'm not sure." And I was like, "This sounds like someone that I could talk to about public health." So it's just definitely like telling the next generation like that's also an option as well, because it's just such a broad landscape of things that we can do that affect the wellness and improve the wellness of the people. So that's definitely very important. Kind of has, as some of you had mentioned in your responses, let's bring the angle of the discussion from the federal view down to the state and local view. And as this is the Greater Providence chapter of Brooklyn Public Health, what would you say from your perspective are some of the most pressing issues specifically affecting Black and Brown communities in or around Rhode Island? And how can emerging professionals, either going into your fields or public health in general, gain skills and tools to properly address those issues?
Some of the some of the major issues and priorities are not significantly different than other communities as far as chronic diseases like diabetes, heart disease, obesity, behavioral health challenges around substance use, and mental health disorders in general. I think on the behavioral health front, there's the twofold challenge of the the trends that we're seeing and then stigma that we're fighting against and trying to overcome so that we can have honest language, honest conversations around around the need to talk about suicide and to talk about depression and saying it's okay to not be okay and it's okay to have a therapist and so all of these things that have been taboo are okay to acknowledge and to seek the right support for. I'll go a double click deeper. In addition to having stigma in Black and Brown communities, there's also, I think we find that there's a lot of communities of faith of whatever persuasion, but then there's stigmas within communities of faith around mental health as well, and that depression is something that can be prayed away or that Christians don't get or that people of faith don't get. So there's multiple challenges in addressing mental health needs, but it's something that is increasingly important to talk about and acknowledge. We had a statement from the, I think, American Academy of Pediatrics that they were in a state of emergency with respect to children's mental health going back a few months ago. And if you disaggregate the data, there's generally worser outcomes for children of color, and that's whether you're looking at clinical data or behavioral risk factor surveillance system data. The data generally show disproportionate outcomes, disproportionate burdens for communities of color. So, one, making sure that we're not glossing over disparities or inequities in our outcomes, and then having the right strategies to promote positive outcomes and to promote health equity, especially given the challenging landscape that we've talked about. So at the local level, Rhode Island is fortunate that, as Angie mentioned, she was the first leader of the Health Equity Zone Initiative, which has been one of our flagship initiatives. And we're one of many communities around the country now that have place-based health equity strategies similar to the HES initiative. And that being community-led, where communities they're conducting the needs assessment. They're saying, this is what I need for my community to be healthy. It could be safe streets. It could be reducing access to alcohol and other addictive substances. It could be that we want to address children's mental health or child safety. So it's really up to each health equity zone to identify what the challenges that they want to address and what are the resources, policy or programmatic that are needed to increase outcomes, improve outcomes. So I'm encouraged that there's a variety of needs and they vary from community to community, but there's actually 11 years now coming up on 11 years now of momentum in the Health Equity Zone Initiative and an opportunity to learn from it, build on it, expand where appropriate, and provide the resources to support health equity within the state and at the local level.
I'll jump in here, and I think Larry talked about a little bit about the mental health, but I want to kind of frame it in the lens of the COVID-19 pandemic. And one of the things, put my social work hat on for a second, is that the pandemic, the way I often describe it, it was a global PTSD. And I don't think we frame it well enough in that frame to really understand what we all experienced. And sometimes when I think about it, it seems so long ago, but it was only 6 years ago, number one. And number two, we had humans by nature were social, right? So um, we had to isolate ourselves. There was an exorbitant amount of people who died as a result. So there was a tremendous amount of loss, and there was a tremendous amount of economic insecurity, instability. And then we had to quickly pivot. We was rushed to quickly pivot to going back outside because, quite frankly, in the society we live in, the capitalist society we live in, we got to go outside. We got to stimulate the economy. So I say all that to say is that it kind of we were isolated. We had experienced tremendous grief collectively and also individually, and then we had we were out of recovery of that, but we didn't necessarily do. When you have a traumatic experience, there are some things that you need to do to deal with that, address that. But I don't think we even describe it and frame it in that way to be able to help us fully recover. And so I will say that I've noticed people are exhausted. People are quietly quitting from their jobs. And then you have, 4 years of us trying to recover under one presidential administration. And then it seems like we're under attack again, right? Where the communities that were, again, disproportionately impacted by COVID-19 are also disproportionately impacted by this administration, right? The immigration policies, the civil rights policies, the women's policies, the spending and where cuts are happening. You talk about the 92% of Black women who voted in opposition of this, and over 300, the highest unemployment rate in group in this country is Black women. So I would say none of this is by chance, and we're not really collectively thinking about how to help us recover from all of this. Because quite frankly, this isn't a priority for this population. But I think the we're still recovering from the COVID-19 pandemic, and I actually was talking to somebody a little earlier today at the event I was, and there's a level of anxiety in the country as a result. You wake up today and oh, my goodness, we're in a war, right? You wake up tomorrow, there's this spending cut. You wake up tomorrow, we've kidnapped this dictator. You wake up tomorrow, this funding is cut. Whether you were not, are you going to have your job because the funding from the federal government has been cut? Like this level of uncertainty is collective anxiety, and then just the vitriol. I was, one of the things I heard today is that a family voluntarily, an educator I was sitting next to today talked about a family that voluntarily relocated back to their country as a result of multiple immigration statuses for their family. And I couldn't help but think about school children who were born and educated in this country, having to dramatically change their lives and go back to their native country as a result of this, and how disruptive that is. Or people who choose to stay, and how anxiety provoking that is. Of, you know, you saw this week where a student was walking to her apartment and then she was collected at, Columbia University. So, like, this is collective stress and trauma, where we are being re-traumatized by the government. And so I think that looking like a public health and social work impact of the collective traumatization of not only from the pandemic, but also the government.
I would just quickly echo just what was shared. I know that I currently reside in Boston, so I'm not in Providence, but from a large city to another large city, definitely echoing what was shared around some of the health issues that we're even seeing here in Boston, that are primarily impacting Black and Brown communities. So unintentional overdose, cardiometabolic diseases, and cancers have been the leaders of premature mortality for especially for Black and Brown communities in the city of Boston. And so we've been really looking towards that because we also, I don't know if folks are familiar, but we have our Live Long and Well Health Equity Agenda, which is speaking to addressing those drivers of premature mortality, which lead to unfortunately having Black residents in Boston having the lowest life expectancy out of all population groups in the city. So we launched this new initiative to really get back into addressing those because the data isn't new per se, or the trends in the data aren't new. Unfortunately, like, these issues have been persisting for a while, for longer than they should have. And so again, back to my earlier point around feeling hopeful, especially because of the work that we're doing at the local level. We just convened yesterday to discuss this new Black Life Expectancy report and to provide monetary funding to local community-based institutions to really help support that work. So again, thinking about social determinants of health, thinking about economic development and mobility, and being able to provide like funding towards what we call certified underrepresented business enterprises, so minority-owned, Black-owned, women-owned businesses who are doing this work, or CBOs who are already in, these conversations with the community and support and can help support this work, I think has been a highlight for me. But yeah, just echoing that some of the same issues that were already mentioned are definitely happening here in the city of Boston, and even thinking about the health equity zones, which I hadn't heard of, but now I'm going to look into even further. Like when we're thinking about life expectancy, as I mentioned, I'm from Roxbury, and Roxbury has the lowest life expectancy and the out of all neighborhoods in Boston. And so thinking back to why I even got started in this work, I lived in Roxbury, my mother lived in Roxbury, and if that woman didn't do her job properly to teach me, well, she should have done her job properly and stayed and made sure that she was attended to clean her wound. But if I hadn't learned how to do that, then my mother would be that number of, someone who passed away prematurely. And so I think a reminder for me as I continue to do this work is that, especially when we're thinking about data, is just we need to we need to remind ourselves that there are people behind these. It's not just numbers, it's people, it's real stories, it's real lives that are being impacted.
Yeah, I can't speak to the issues in public health, but to piggyback off of what Alexander said, in the law, one of the issues that I have found is that there is a underrepresentation of people of color who are becoming attorneys when you take the statistics of what's a percentage of people of color in the state of Rhode Island versus what's the general population of attorneys who practice in Rhode Island. And so a few years ago, in my capacity as chair of the DEI subcommittee to the Federal Court of Rhode Island's Advisory Council, we endeavored to publish a survey for all attorneys in the Federal Bar of Rhode Island to answer. And one of those questions is, what is your race? And what is your ethnicity? And what we did was we took the amount of attorneys who identified as Black or African American, and we compared that number to what percentage of the population of Rhode Island is Black or African American. And I have the numbers in front of me. Based upon this survey, 1.74% of the attorneys who answered this question in the Federal Bar of Rhode Island identify as Black or African American. So that's only 1.74%. Whereas according to the 2020 census, the Rhode Island population of Black or African American individuals is 6.1%. So there's a gap there of about 4 to 5%. And when it comes to, we asked the same question as to whether attorneys identify as Hispanic. And I have the numbers here. According to this census, of the attorneys who answered the question, only 1.68% identify as Hispanic, whereas the Rhode Island population, according to the 2020 census, is 13.4% Hispanic. So there's an underrepresentation of about 11-12%. So there is a serious underrepresentation, at least in the federal bar in Rhode Island, that we're grappling with.
Thank you so much. That felt like an epidemiology lecture. I really appreciate that. Thank you. I appreciate all your responses. For the next question, when it comes to as we've seen, things we're under attack as a nation when it comes to funding cuts, right? Especially for, younger students, emerging professionals in public health, even, pre-law students, pre-med students, all of these fields have opportunities to specialize in the private sector or the public sector. But when you're seeing, funding cuts, layoffs, people losing their jobs, people not really having much options in terms of applying for jobs and actually being able to start employment in the public sector. What do you recommend for young students and emerging professionals when who are trying to be strategic about choosing their internships, choosing their first jobs, or related research and leadership opportunities? How do you recommend that they still stay aligned with their career paths and that they're focused on equity and justice throughout that?
I would start off by saying, first, we need good people in public health. So the reality that we're facing now and the effort that we're able to mount at the local, state, and federal level across communities is only possible if we have people with good values, the right skill set, and the right knowledge in public health. That's first. The second thing I'd say, something we hinted at earlier in the conversation, is public health is, however broad you think public health is broader than that. So you can find a role that's public health. You might think of it as public health adjacent, but if you think it's public health adjacent, it really is public health work. And whether you're addressing workforce needs or economic opportunity or health policy and regulation, those are all important disciplines and settings for public health practitioners to be in. So the so the options are broader than you might think. The other thing I'd say is the skills and knowledge that you'll acquire, and whether it's as an undergrad, graduate student, doctoral student, those skills are transferable to many more settings that employers might not even realize how valuable you would be bringing a public health lens and public health mindset and tools into their environment. So some of it is about how are we promoting and making public health appealing as a field in this moment? And then second, for people who are entering the workforce, how are you branding your skill set and your expertise for in a way that's appealing to employers? So it's a little bit of a two-sided equation, um, but the reality is that yes, it is a challenging time, and because it's a challenging time, we need good people in public health. And then the reality is wherever you think the lines of public health end, it's beyond that. The last thing I'll say, and it kind of speaks to some earlier discussion points as well, public health is a team sport. So no one part of the public health sector is going to be able to advance health equity and improved outcomes by itself. We need people in policy. We need people in programs. We need people in philanthropy. We need people in community. We need people in state, federal, and local government. We need people across the board and all doing things that contribute to improved outcomes. And it could be that where someone in government might not be able to say something or use specific wording or put out specific reports, they can partner with a community-based organization or a quasi-governmental entity to accomplish that same mission. So there's an opportunity for collaboration, for public-private partnerships, for academia to partner with community and with government to advance a shared mission. So those are some things that I would offer as food for thought, and I'll end with the note of please, we need good people in public health now more than ever. So don't don't get scared off. We can do this.
And the only thing I would add to what Larry said is we also need people on the ballot box. We also need people signing up to help or signing up to help those get on the ballot box. And third, supporting people who are there, because oftentimes the people who look like us are few and far in between, and it can be a very, very, very lonely place because they're fighting and they're fighting alone. And so, if we can support in those three different ways, get on the ballot box yourself, support somebody to get on the ballot box, or when they're there to provide them support as well too. Because, one of the things that I'm really excited about today is, Joshua's, partnership in this because yeah, a lot of the work and the progress that we've made has been in policy and social action and rules and regulations. And so we're gonna have to continue to fight that good fight. And it involves, people from all sectors, like Larry said.
Thank you so much for your responses. Oh, sorry,
And
Angela. You want to say?
one more thing I add,
Yes, yes.
like our former president said, don't boo, vote. We got to get to the we got to get to the booths. We got
Absolutely.
to get to the booths.
Thanks. Yes, we do. Yes, we do. Thank you so much. I'm gonna take a moment to open it up for questions from the crowd. We do have a few more questions if no one has questions, but I want to give the crowd opportunity to ask your questions. We have some great, brilliant minds here. You've heard a lot of great information, but now is your time to ask any questions you have specifically.
Hi, my name is Anay Scott. I'm getting my master's in public health here at Brown University. And just wanting to hop on and ask a quick question about something that's kind of come up before of public health being such a broad field and you as an individual may having like various different interests. How do you, throughout your career, or maybe the best way to approach this is, can you provide examples of throughout your career, kind of like bouncing back and forth, and what's that been like, and how do you navigate changing your mind about how you want to approach public health?
I'll add a little here. One of the things that didn't immediately come to me as a public health priority when I was school and early in my career that has become really something personally and professionally important to me is public health, intersection between public health and housing. I know during the pandemic, we realized how important it is to have a place to stay. Well, it's always important to have this place to stay, but it's incredibly important to have this place to stay all the time. And one of the areas in which I've been really active is housing and housing policy, and just housing design for safe, healthy, and affordable housing. And so I think that's been the area where I've had to learn a lot from as a public health professional. Nothing prepared me to understand housing laws, but I do know, and this is like my Africana studies background. History taught me that housing policies and how redlining, brought us to a lot of the issues and the disproportionality in housing that we see right now. Rhode Island has one of the lowest rates in the country of Black homeownership right now. And we know that Black homeownership is one of the pathways to family wealth and resiliency. And in Rhode Island, it's one of the least Black, the percentage of Blacks who own homes is the lowest in Rhode Island, definitely in the region, and if not close in the country as well too. And so that's one that, and so, I how have I done it is really, really looking at the interconnection of between public health in various areas. And, I've been a student. I, I feel like I'm always a student, because I had to learn a lot about public health policy when I was at the Department of Health, I had to learn a lot about zoning policy because we would do a lot of with state and municipal and comprehensive plan. So, I wasn't a planner, but I had to learn about urban planning, how to learn about, environmentalism, because environmentalism and, brownfields historically impact our communities as well too. And so, whenever there's a topic or area that I'm interested in, I feel like I have to go to the people who are in this space and learn more about their work, but also then also bring the public health lens to the work that they're doing as well too.
Thank you.
The other thing I would add is that it's quite okay to change your mind on what you want to do, how you're learning from previous experiences to shape your future vision. I'm a firm believer in letting every experience inform future experiences, and there being um, great value in having a nonlinear path. Mine was every time I talk to early career professionals, I say my career trajectory was as nonlinear, as zigzagged as they come. I spent a decade and a half as a career firefighter and EMT, which really opened my eyes from a different perspective on systems and community. I saw disparities there that I didn't have the language, the tools, or the skill set to affect change for. But then when I brought those experiences and perspectives into the classroom, I pursued an MPH full time while working full time. That was a game changer, and that allowed me to both speak the language of community, speak the language of systems, and speak the language of public health in a way that brought important stakeholders together and that put me on a whole different trajectory. So it's really about for me, it was a matter of how am I using my current experiences and perspectives to inform what I want to do. Am I accomplishing the type of change that I want to? Am I passionate and feeling satisfied by the experiences that I'm having now? And then recognizing that you can't necessarily get every experience, or it's not common to have every experience wrapped up into one setting. Are there ways that you can complement that with, if you have the capacity, volunteer service, either on a board of directors or just volunteer service in general, that gives to the community and also benefits you because you may acquire new perspective, new skills outside of your day-to-day paid job that can set you up for a new opportunity down the road.
Thank you.
Now, just quickly, definitely advocate for yourself, use your voice, continue to be inquisitive. I feel like a lot of the opportunities, even now in my current role, I've been able to get because I've asked to join. And Boston Public Health Commission is a whole bunch of different bureaus. We have over 1,400 employees. But I always go out of my way to see, oh, like that project sounds interesting. Like, is it possible for me to support? So always just making sure that you are advocating and for yourself and for the interest that you have. And I feel like more often than not, more people will definitely be willing to take you under their wing or to, help support you. And then the last thing I would say is just also take time to discern. I think we get too caught up in like the thick of things and we're always running around with so many different priorities. And I've caught myself having to remind people at work in particular, like, you all need me to think, so I actually need time to think. And so even just thinking in my own personal life too, like it's really needing to be a little bit more intentional and carving out those spaces to reflect and discern and see what is going on for you, what is coming up for you, what your interests are. So yeah, we don't do that enough. I feel like we're always running around, so definitely just take time for yourself as well.
Thanks so much for the responses.
Mhm.
Hey, what's going on, everybody? My name is John Tay McKenzie. I have a question for Mr. Joshua. So as it pertains to holding people accountable, what accountability mechanisms exist when, let's say, public health decisions in Rhode Island disproportionately affect marginalized communities, and what can we do to help hold those individuals accountable?
Yeah, it's a great question. And so one mechanism is kind of what I discussed earlier in that real life case in which a federal judge in Rhode Island ordered the Trump administration to fund SNAP benefits. In the legal world, that's what's called an injunction. An injunction is essentially when a court orders an entity or an individual to do something or not do something. And in that instance, it was an order for the Trump administration to fully fund SNAP benefits. I really appreciate you bringing up the word disproportionately. And in that word triggers a legal doctrine that I'm very familiar with, and that's the legal doctrine of disparate impact. And disparate impact in the legal world has a very specific definition. Disparate impact, generally speaking, in the legal world, usually refers to a policy that on its face is neutral, meaning it's not specifically or explicitly targeting a group of people. It's not targeting a particular race. It's not targeting a particular subset of individuals with certain incomes, right? It's a neutral policy. However, when it's implemented, it has a disparate impact on a subset of people or a subset of individuals. So I'll give you an example. Title VII, which is the most preeminent employment discrimination statute in our country, it was signed into law in 1964, says that if an employer has a neutral policy, but ends up having a disparate impact on a protected class, then that policy can be held as unlawful under Title VII. And it's the same concept when it comes to public health. If a group of people can gather enough evidence to prove that a public health directive or public health order has a disparate impact on a particular race, then the law, specifically the Constitution and the 14th Amendment, allows that group of people to sue the government or the entity that created that order. And their argument would be this law or this directive is unlawful because it's disproportionately impacting a group of people, whether it be African Americans, Latinos, or what have you, because the Constitution and specifically the 14th Amendment codifies that protection that the government cannot treat different races unequitably, or it can't target a specific race worse than another group of people. And so there are avenues in the law to attack these what seemingly are neutral policies that have disparate impact. And I kind of piggyback on a question earlier. I would encourage folks to take these legal classes or these legal courses, these legal seminars in your place of education. A lot of schools have some sort of law and public health class that you can take, and you can talk about this intersection behind the law and public health and how a group of people can go about proving that a public health directive might be unlawful or unconstitutional.
Thank you. That makes a lot of sense. I really appreciate it.
Sure.
Hi, everyone. My name is Shuvo. I just had a quick question for the broader group. As someone who works in tech, my question is for folks who are working in the public health space. As technology and AI continue to expand throughout society and the economy, what are some of the unintended consequences that might have an impact on public health? And are there any potential benefits?
I think technology has definitely afforded us a lot of advantages in public health in general. When it comes to the rapid growth of adoption of AI and machine learning, we do have to be mindful about how we're training these algorithms and systems. What data are they learning from? What what are the use cases and the applications and unintended consequences to your point? It can be, I'll start off with a couple of simple examples of not even AI based unintended consequences. But if you think about something like a pulse oximeter, which reads oxygen saturation by, usually attached to a finger, or it's placed on finger or toe. Um, if if the clinician is using a pulse oximeter and the pulse oximeter is not taking into account the difference in the melanin in one's skin between a black or brown person compared to a white patient, and then making clinical decisions that may assume that, oh, Larry might be better off or not needing to be placed on oxygen because the machine is reading um, differently than it is for someone who might have a lighter complexion and has a different clinical presentation. That could have an unintended consequence. So there are some clinician technology interfaces that we have to apply some common sense to, and a health equity lens to how we're interpreting data. Then there are things like uh, kidney function and the EGFR measures to which an African American adjustment was being applied, but that's not based in science. And so there are unintended consequences where medical education is is promoting faulty clinical decision making, or we're programming that into algorithms that might have two patients with the exact same clinical kidney function reading. One has an African American adjustment applied, and then they become a lower priority in a clinical decision making pathway, or might be uh, uh, made a lower priority or ineligible for a kidney transplant if that's needed. So there's a lot of potential consequences where we are not attentive to either biases that are built into algorithms or the data that we're feeding into tools that are making clinical recommendations, and then how we're interpreting data at the human interface to make decisions on clinical decisions or policy decisions. So those are a couple of examples. I think we'll likely learn a lot more real quick about how we're having some unintended consequences. And one of the things I'm optimistic about is there has been an ongoing body of work around the adoption of artificial intelligence and machine learning to advance health equity that was funded by the NIH before the change of administrations. It's still in place, and it's a body of work that will benefit public health more broadly. Um, Knock on wood, so far it hasn't been terminated. That's a space that we may glean some very important insights, and that's the Aim Ahead initiative. I'll drop the website in the chat in a moment, but that initiative has an opportunity to both accelerate and to ensure that we're not seeing unintended consequences when it comes to health equity as we're adopting AI in public health and healthcare.
True. Well, thank you for your question. I actually am still like learning more about AI and just enrolled in the AI and public health course with Brandeis University. So we've been having our sessions, and I think one of the things that came up in that program so far for me is just the fact that we still need to be thinking about who's checking this work. So having humans, there still needs to be human safeguards in place to make sure that the biases that Dr. Warner was mentioning don't, perpetuate violence or harm. But definitely echoing that technology has been helpful, but I think that that part around just the biases that still are at play, especially in the coding and the algorithms, there was a incident where a community health center was using AI for like their automation update, for their updates around sending when health centers like they'll send like the clinic will send when it's time for you to like to get a new vaccine or if your prescription or something like that. And so it went awry and folks who needed their vaccines or who needed their prescriptions, particularly, their patients of color weren't receiving those messages. It was altering the schedule of when those messages would be sent to those patients. And so I think that that is an example of, again, we need to be making sure that there's still human safeguards. Can it help with efficiency? Sure, but those biases are still there, unfortunately. And I think we also need to do better with really understanding and reconciling the environmental impact that AI has had, particularly for Black communities. There's been a lot of research that's been out around like this new wave of environmental racism for that AI has been contributing to, especially from a pollution standpoint. So I think I can see it as a hopeful tool, but I think we really need to be thinking a little bit more about the environmental impact of AI use as well.
Got it. Well, thank you, Alex and Larry, for the insight. Also want to thank the rest of the panel for your much needed support in the communities that you serve.
No questions from the crowd. Right. Well, we'll move towards closing. I have one final question for our panelists before we close. Are there any last words of encouragement or advice for our attendees and anyone that may be going into your field or the related fields throughout public health, law, medicine, etc., that you wish you had heard when you were first starting your career journey?
One of the things I'll say, I think Larry mentioned this a little earlier, is that what you do now in public health doesn't have to be what you do now in public health doesn't have to be what you do for the rest of your life, right? And you don't have to know exactly what you want to be and stick to it. Some people do, and that's completely fine. But I think that I started out with social work and then public health and State Department of Public Health, and then I was in philanthropy for about 8 or 9 years, and so I think your interests can evolve. I think one of the common things, and one of the things that's been the common denominator is the focus on Black and Brown, historically marginalized communities, policy and systems change, and the fight for equity and justice. I think that's one of the things that's been constant in regardless of what I have in at whatever space I've been. And so, I one of the things I've talked about is, what are your values and how can you bring your values and your principles and can you bring those to whatever sector and space that you're in. And I think that'll help guide you in terms of what you do. So yeah, I wouldn't have guessed that I would be doing what I'm doing now and have the experience that I experiences now, but my purpose and values have guided me. And it's also helped me to be authentic, to be really sure about my purpose and the communities that, whatever table I'm sitting at, I know what my purpose is and what my goal is as well, too. So I think that's what I would want people to know, that you don't have to have it all figured out. And just make sure that you know what your values are and then let that guide you.
I say ditto. Very well said. Follow your curiosity, stay true to your values, and in wherever you find yourself at whatever stage in your professional journey, as important as important as it is to contribute to the greater good of the community, you also can't be helpful in the field if you're not taking care of yourself. So, especially during difficult, traumatic times, take pause, step back, have a self-care plan or some way of creating space and time for yourself in addition to your professional and academic pursuits. Um, so there may not be enough hours in the day to do everything that you want to do, but do what you can and make sure you build in some downtime and self-care time. So that's the one thing I would add.
Echoing others, and I'll just add quickly, and I know it's easier said than done, but just thinking of us as, people of color, and I can't see everyone's faces, so I'm gonna assume that folks might be of color, but even if you're not of color, just thinking of, the impact of imposter syndrome, I think one of the things that I have to continue to remind myself and that I hope that you all would know, especially as I think some of you are in your MPH programs, to really just trust in the expertise and the knowledge that you're gaining, trust and understand that you are capable, and that you're probably more capable than you sometimes allow yourself to think. So that's what I would leave with you all.
I 100% agree. I think Alexander and I literally had the same thought. I actually wrote down in my notes imposter syndrome. And I feel like imposter syndrome runs rampant within communities of color. I think from my vantage point, it's something that I've certainly struggled with. There was a time where an opportunity was presented to me. It was a great opportunity, a very coveted opportunity, an opportunity that does not get offered to many people in my line of work. And I said no. I said no because I was worried about failing. I said no because I was worried about letting people down. I said no because I thought I wasn't good enough. I said no because I really enjoyed and I respected the individual who was giving me that opportunity and didn't want to let that person down. But now, hindsight being 2020, I should have said yes. I should have tried. And now, as I've gotten older, my attitude is I'd much rather live by trying and resulting in a failure as opposed to not trying at all. I'd much rather try my best and fail as opposed to live life with regrets by not trying at all. And that's my message to all of you. Second piece that I have is please, please, please don't forget about the people behind you and the people who need you. I'm a big believer in mentorship. I think that having a really, really good mentor can create so many opportunities for you. And so as you progress in your work, as you become leaders, as you possess those resources, don't forget to pass those resources on to the next generation. Because I have found that a good mentor can offer things to their mentee that traditional school cannot offer. In school, you learn great facts, statistics, get great grades, and maybe that leads to a great job. But a mentor can actually get you indoors and opportunities and jobs that your school could never provide to you. A mentor can write you a letter of recommendation. A mentor can pick up the phone and call other people who have influence in our society to help the mentee get those opportunities and have those resources. A mentor can breathe life into their mentee. A mentor can instill that kind of confidence that they might need. So I would encourage all of you to never forget the people behind you and to really, really go out and find that mentee, find that person who might need you.
Absolutely. Thank you so much for those responses. We really appreciate y'all's time here, our esteemed panelists. I've learned a lot just in this conversation alone, and I'm sure the attendees feel the same sentiments. If any attendees wish to reach out to you to speak more to you, maybe gain some mentorship in the spirit of mentorship, right? if you wish to be contacted, please feel free to put your contact information in the chat for the attendees. I would really appreciate that. But with that, y'all, thank you for coming. We really appreciate y'all coming to our launch event in the public health and the current climate discussion. We look forward to seeing some of you in the future, especially any of the men on here that are interested in becoming members of the Greater Providence chapter. We have the form in the chat for you. Anyone that's either not located in the Providence area or you may not be, our target audience for membership, please feel free to still keep in contact with us and follow us on our socials. And we definitely will continue to have events throughout the year that, while we do focus on men of color and public health, if there's something that we're doing that you want to do or you want to help out with, you're more than welcome to attend as well. So thank you all again for coming. And we will close, and y'all have a great weekend. And panelists, I'll ask you to stay on for just a moment before we leave. But y'all take care. Have a great weekend.